It was supposed to be a routine surgery to remove a benign growth from Peggy Simeonetti's breast, but a biopsy found a small cancerous tumor.
And that was pretty shocking. I hadn't expected that at all.
The early detection meant quick treatment, which included a battery of tests.
And then I needed to have a chest x-ray, and I think it was a liver ultrasound and a bone scan. And I didn't realize initially that those are completely routine.
X-rays, ultrasounds, as well as CT and bone scans are routine, but not always needed.
For many women, these tests are really unnecessary. They don't detect disease, and they don't provide reassurance.
According to a review of thousands of Ontario patients with early-stage breast cancer, about 85% had at least one further diagnostic scan to ensure the cancer hadn't spread. But scans to determine if it has spread are only effective for about 1% of patients. That's why most medical guidelines discourage scans for those with early-stage breast cancer, yet the extra tests continue.
Partly it's to try and reassure patients, of course. The breast cancer diagnosis is devastating, and so for many people, common first question is, are we sure it's not anywhere else?
We'll be taking pictures of your brain.
That desperation for answers can not only expose patients to excess radiation, but also pull doctors down rabbit holes that may only further jeopardize the treatment of their patients.
The biggest downside is that if somebody goes through this test, we may find a small little nodule which is irrelevant. That requires us to do some more tests, some more biopsies. So there's complications that may arise from these biopsies. There are delays that may happen.
For Peggy Simeonetti, follow-up tests only confirmed the cancer had not spread. Despite the risks, she has no regrets about the extra scans.
I would hate to be the 1% of the population who would have benefited from the test and found out 2 years later that it was a little bit late to start treatment.
Vic Adopia, CBC News, St. John's.